Hi, I'm Laurie Dhue, reporting from the Democratic National Convention. I've just come out of the Recovery Caucus meeting. I was lucky enough to be one of the speakers today, along with former Congressman Patrick Kennedy. Patrick, thanks for taking the time to talk with us today.
You bet, Laurie.
So what was your major message today when we're talking about the parity law? It still doesn't have the teeth it needs. What needs to happen so that we can get there?
Well, enforcement of a law is critical to its execution. And before we get enforcement, we need to know what we're measuring. So the rule of the parity law means that's going to define what we mean by parity, which will allow us as advocates to know whether we can measure whether an insurance company is adhering to the law or violating the law. You will only know that if you come up with the metrics by which to evaluate, are they providing equal coverage? And of course, in mental health care, there are additional services that aren't in the medical model per se. Like, we don't want to just see psychiatrists. We want to have sober coaches. We want to have wraparound services. We want to have supportive living services available. And so what we mean by parity in the rule is, how are we going to define how we hold insurance companies accountable for the way that they adhere to the spirit of the law. So the law says you have to provide equal coverage for mental health as you would surgical or medical.
Right.
But the way you define that is where the war is fought.
Is that why it's taken so long?
It's a new area. Obviously, the science of mental health care is still formative. But we know enough to know whether an insurance company is being honest in adhering to the spirit of the law. But what we need to do with the rule is make sure we have the metrics, the definitions of how we're going to evaluate that.
Okay, so if Obama is reelected, then...
When Obama is reelected.
Okay, when Obama is reelected...
I'm wearing my partisan hat. We're at the Democratic.
Well, no, absolutely. I'm just saying that if and when he is reelected.
But you know, Mitt Romney needs to do this too.
But there is nothing in the Republican platform that calls for anything like this.
But you know what? Ann Romney has MS.
Yes.
And people suffering from MS need the same thing as people suffering from depression, from addiction. They need the kind of chronic care management that is going to be part of their health care. So my point is that we all need the same thing, and we need to fight together to get it done.
This is a nonpartisan issue. It's not Democratic, it's not Republican, it's an American issue.
That's right.
So in general, moving beyond parity and just talking about recovery in this country, what do you think that we advocates can do in terms of bringing drug policy and recovery more into the national forefront and frankly, into the dialogue on Capitol Hill and beyond?
Well, we were just at a Faces and Voices of Recovery. What does that mean? That means we need to be faces and voices. We can't just keep this, under wraps, because that's what keeps it stigmatized and that's what keeps it marginalized. And so if we truly want people to be treated holistically from the head down, then we need to make sure that all the things that we would expect to be treated for if we had cancer,
or diabetes,
are the same kinds of treatments that are available for depression, addiction, MS, autism, Alzheimer's. The bottom line is we need people to be engaged, and that's what Faces and Voices of Recovery is doing. I know that's what you're fighting to do, and that's what we need to do more, because only through active engagement are people going to have their lives changed.
Final question for you. Do you see a day where we can talk about recovery in the same way that we talk about AIDS and breast cancer and some of these other major health crises where billions of dollars have been raised, millions of people have been saved? Do you see a day where we're on that level?
I absolutely do, and I think that the experience of our American heroes, our men and women in uniform returning from battle who are suffering from quote-unquote an invisible wound of war, that their fight is our fight, because suicide is claiming their lives at record numbers. And frankly, they're facing stigma and they're facing marginalization because of their illnesses. And that's the fight that we've been fighting for. So they are a new community. of recovery. And frankly, everybody is in recovery from something.
And it affects every single family in this country in one way or the other.
Absolutely. And I thank you for your being a face and voice of recovery. And I think as consumers, we can change the world that's going to happen for our children and the next generation by the way we help change the way people look at recovery. So thank you for that.
And thank you for being a champion.
You bet.
Thank you so much
Thanks,
for your
Laurie.
time. I'm Laurie Dhue, reporting for Renew Magazine with former Congressman Patrick Kennedy, major recovery advocate.